Hello, and welcome to the Malaria Notebook with me, Liliana Dayo. Today, I'll be speaking about the impact of the malaria vaccine in Africa's journey toward elimination. Welcome. So, what about the malaria vaccine? What does it bring to the table? It brings new hope in the journey to eliminate malaria. For decades, malaria has been one of Africa's toughest health challenges. In most parts of Africa, reports on people suffering from malaria and also dying from it have never stopped. Today, the malaria vaccine stands as one of the biggest milestones in this fight, giving us new hope on the journey toward elimination. Malaria continues to affect millions across Africa, especially children below the age of 5 years. After years of research, 2 effective vaccines offer new hope. For the first time in history, malaria can be prevented not just with nets and medicine, but also with a vaccine. This is a remarkable breakthrough happening right here in Africa. So how does the vaccine work? We currently have 2 types of vaccines, the RTS S and the R21 vaccines. It helps the body build immunity against Plasmodium falciparum parasite, which again is one of the most deadliest parasites of malaria. This reduces the number of people who develop malaria disease and severe illness amongst children. By reducing infections, it helps break the cycle of transmission and protects even the unvaccinated individuals through the herd effect. Initial outcomes of the malaria vaccines in the countries where it was piloted indicates that fewer malaria infections among children under the age of 5 years was reported. It also contributed to reduced hospital admissions, especially those from severe malaria, and a visible drop in malaria-related deaths. This table is a summary of the report from malaria data in countries where the vaccine was piloted between 2019 to 2024. In Ghana, it was reported that fewer malaria admissions among children aged below the age of 5 were reported. It also contributed to reduced deaths and led to increased caregiver confidence, especially during immunization. In Kenya, there was a decline in malaria-related hospitalizations, especially in children, and lower severe malaria cases in the high malaria burden areas. In the community, there was a high turnout of children for the routine immunization, including that of malaria vaccine. Similarly, in Malawi, there was a noticeable drop in under 5 children suffering from malaria. Generally, there was early success with improved child survival and vaccine acceptance in all the 3 countries, with gradual reduction in malaria burden and improved service uptake. This demonstrated real-world effectiveness of the malaria vaccine. The malaria vaccine is not a replacement for other interventions. It's actually an addition to the malaria toolbox. It's important that as much as we ensure that the children below the age of 5 years are vaccinated, they need to continue using mosquito nets and also embrace indoor residual spray where applicable. It's important that we also maintain preventive treatment in pregnancy and for children. We need to ensure prompt testing and effective treatment for all those who have got signs and symptoms of malaria, and also strengthen data systems to enable us to track every malaria case. As we wrap up, malaria vaccines symbolize hope, resilience, and African innovation. It is an integrated approach that not only saves lives, but also accelerates Africa's journey towards malaria elimination. On reflection and understanding, what does the malaria vaccine mean for our communities? And how can we combine the vaccine with other malaria interventions to make a bigger impact? What lessons can we learn from countries that have already introduced the malaria vaccine? And how can we ensure every eligible child receives recommended doses? Thank you once again for listening. Let's keep subscribing for more lessons from the Malaria Notebook. Let's fight malaria one lesson at a time. Thank you.